Hello, my name is Joanna Rodriguez, and my presentation is on Tanasis cysticercosis. During my presentation, I will mention the agent that causes this disease, the types of exposure, the symptoms, the current local issues of the disease, and the ways in which you can prevent yourself from becoming infected. According to the World Health Organization, Tanasis is the intestinal infection caused by adult tapeworms. There are two types of tapeworms that can cause this infection in humans. First, there is T. solium, which is the pork tapeworm, and there is also T. saginata, which is the beef tapeworm. T. solium has hooks on its anterior end, and T. saginata has suckers on its anterior end. Now, these characteristics allow them to attach to their host's intestinal walls. This disease represents a parasitic relationship because the parasite, which is the worm, survives by feeding on and harming its host, which is an animal or a human. As mentioned in the book, Essentials of Environmental Health, cysticercosis is a form of Tanasis. However, it is specific to the worm T. solium. In cysticercosis, the tapeworm larvae hatch and migrate to muscle tissues and even brain tissues, where they form cysts. If in fact they reach the brain tissue, the brain will become damaged and they will leave lesions in it. This can result in blindness, dementia, chronic headaches, and even seizures. Now, there are different ways in which you can become exposed to the two different tapeworms. First, there is the T. solium tapeworm. Now, there are different steps in which you become exposed. In step 1, there is fecal matter in the environment containing tapeworm eggs or gravid proglottis. Gravid proglottis is the section of the worm that contains the egg that detaches and ends up in feces. In step 2, the pigs eat the infected feces. Step 3, tapeworm eggs hatch in the pig's intestines and travel to the muscle where they become cysticercosis. Step 4, if humans eat undercooked pork, they ingest the Tania eggs and become infected. In step 5 and 6, the tapeworm grows and causes intestinal infection in the human host. In the final step, tapeworm eggs, or the gravid proglottis, exit the human body through feces and contaminate the environment. There is also an alternative way that humans can become exposed to T. solium. If they come in direct contact with Tania eggs through contaminated soil, water, or food, for example in vegetables, the tapeworm larva can infect them and travel to the brain and eyes, causing cysticercosis. Now, exposure to T. saginata involves the following steps. In step 1, there is fecal matter in the environment containing tapeworm eggs or gravid proglottis. In step 2, cows eat infected vegetation, for example, grass that is infected. In step 3, the tapeworm eggs hatch and penetrate the muscles as well as the intestines of the cattle. Step 4, if humans eat undercooked beef, they ingest the Tania eggs and become infected. In step 5 and 6, the tapeworm grows and causes intestinal infection in the host. In the final step, the tapeworm eggs, or the gravid proglottis, exit the human body through their feces. Now, T. saginata is not as threatening as T. solium because it does not cause cysticercosis. Now, there are symptoms to Tanasis and cysticercosis. Tanasis is actually quite asymptomatic. If you do find that you have symptoms, they will be mild and non-specific. For example, this can include abdominal pain, diarrhea, and nausea. In cysticercosis, it depends on where the cysts are formed in the body. If they are in your muscles, you will find lumps underneath your skin. In the eyes, you might have blurred vision. And in the brain or spinal cord, you will experience headaches, psychiatric disturbances, seizures, or even death. Those that are infected will have tapeworm eggs in their feces for about 8 to 12 weeks after their infection. According to the California Department of Public Health, an adult tapeworm can live in the intestine and lay eggs for up to 30 years. Symptoms may persist until the tapeworm dies. Symptoms of cysticercosis may not become active until weeks or even years after the initial infection. In treatment, patients may be issued antiparasite medication, However, in cysticercosis, they may require surgical removal of larva cysts in the body. Not all cases are as severe as others, and treatment will prevent the spread of infection in other people and animals. Now, Taianasis and cysticercosis on a global spectrum. Infection is most common in underdeveloped countries. For example, these diseases are highly endemic in South America and Africa. Populations that consume higher amounts of pork are also more likely to develop the disease. This disease is prevalent in areas that lack sanitation, also where pig and cattle are allowed to roam freely and are therefore in contact with more feces. Immigrants are often most commonly infected with the disease, and Americans are infected most often when they travel out of the country. And local issues, according to the article Cysticercosis, the first 12 months of reporting in California. Cysticercosis became a reportable disease in California on April 1st, 1989. There were 134 cases recorded that year. Those that were infected were primarily Hispanic, or they immigrated from countries that were endemic in T. solium. Most of the cases that were reported during this time came from the Los Angeles area. Now, the U.S. National Library of Medicine also conducted a different study for cysticercosis cases in the U.S. from 1990 to 2002. During this time, there were a total of 221 patients, and the mortality rates from California made up 60% of the total. And ways that you can prevent yourself from becoming infected. The T. saginata worm from beef can be controlled by individual measures since it is not as pathogenic. However, the T. solium worm requires public health intervention. Protective measures should be taken when handling pork and beef. Remember to cook meat thoroughly. Maintain proper hygiene when handling meat, for example, washing your hands after using the restroom and before handling food. You should also improve pig farming, in which you will sanitize the area to prevent open defecation. That is my presentation. I hope that you now have a better understanding of the agent that causes Cysticercosis, the ways in which humans are exposed, the symptoms of the disease, the current local issues, and ways in which you can prevent yourself from becoming infected. Thank you.